Darren, Upstream Health. Come and tell us a lot about your story. So Darren, ladies and gentlemen.
Thanks, Rachel, and hi, guys. I'm going to introduce you in a moment to Bridgit, but first I just wanted to talk to you first about my granddad, Dougie. Dougie is the strongest guy I knew when I was growing up as a kid. You know, he painted ships during the day and looked after us and my brothers and sisters during the night. This picture was taken 5 years ago, and over that time, you know, he's had some quite difficult issues to deal with. His vascular dementia's got worse, my nan's passed away, but he really wants to stay well and in his own home. My mum supports him the best that she can, but she struggles because she can't be there all the time. You know, my previous job was working in the NHS, managing a team of nurses, trying to look after people just like Dougie. But we really struggled to find a solution that would allow us to provide the preventative care that we know we need to deliver by monitoring him and supporting him in his home. We looked around, but most of the technology out there is like push-button radio stuff, which doesn't really support or get any of the benefit that we know we can bring with new age tech. And actually, the industry in health is all app focused. You know, there's 50,000 apps there, and they're all useless for people that don't use mobile phones and don't have the internet in their houses. So at Upstream, we thought we could do something better, and actually, we believe that there's a generation that deserve better from a health technology companies like ourselves. So we went around doing something new. So we produced Bridgit, so something from the ground up that is designed to help people to stay well and in the houses that they want to be in for longer and for better in terms of the environment. We've totally redesigned what the interface would look like to suit that group, and this provides a simple messaging solution so that Grandad can communicate and ask for support, so that messages can be sent to him from his care team, but she does so much more. We've got a range of different sensors within Bridgit that allow us to track heating, temperature, movement, air quality, all of the key stuff we know we want to track for preventive care delivery. We've designed it to not need any wires, any internet connection in the house, so Dougie doesn't need to worry about that. And we've also built into it the AI capability from Microsoft. And you know, we talk about Bridgit as being the family friend that's there all the time for our nans, for our granddads, for our mums and our dads. You know, a lot of people that can get the benefit from Bridgit. And the data bit's really cool, right? So we're getting 40 different bits of information from the patient's house and from the patient. And we can take that data and we can harness it in different ways. Initially, we're using conditional logic so that we can do simple things like track a patient's heart rate over time and look at what that means in terms of their conditions and their care plans, through to looking at their movement and if that becomes erratic, or mental health and tracking their mood and actually day on day which of the days which the patients may be struggling and need support. We're building on that now with anomaly detection and machine learning. And our ambition is that we can effectively give, you know, the nurses that I had as a team before, effectively their own DeLorean. So they can look 1 week, 1 month, 1 year into the future. And we can then take the actions today to help them stay well, to take the actions today to stop that hospital admission in 6 months' time. We're a social enterprise, so registered as a social enterprise, and we're designed for big social impact. We want to help the 2 million people like my granddad and like I'm sure many of your family members in this room. We want to support people like my mum, 1 in 7 million people in the UK that are underpinning the health service through informal carer roles. And as Matt Hancock, our health secretary, said, and maybe PM next week, who knows, prevention is better than the cure. And we know that actually prevention is sustainable. We're working as part of our initial trial with the NHS to prove that we can return a saving to the system of £10 for every £1 invested. We are UK-based, but it doesn't really stop there. We are getting a lot of interest for this solution outside of the UK. We've been invited to China, so the Chinese government's paying for us to go over there, which I'm quite excited about, in July. And then we've also got an opportunity to move into the US market. So it's really opening up in terms of the demand for this type of solution for our populations around the world. So what are we looking for? Well, it was number 1 and 2 on the list that Anne mentioned earlier. We do need money. So we're looking for seed funding to help us expand, to help us grow, to help us move into new territories. And we're also looking for strategic partners. But, you know, if you want a coffee, that's cool as well. And because we're Yorkshire-based, if you fancy a cup of tea, then that'd be nice. I'm Darren, this is Upstream, and I'm looking forward to speaking to you all later.